Hi everyone. This is about artificial intelligence. Just provide some examples. What you can see. So in different applications, we can see different kind of things. So my name is Atiq. As you can see here, that this is one video. This is another video from depth image from chemo dataset, and two different kinds of activities. Can you understand based on AI? So we know that remote patient monitoring, say I'm a patient or a person from home. Can you monitor me as a doctor? You are a doctor, from a hospital. Can you monitor my activities and conditions and good or bad so that you can call me in the hospital and something like this? So, for example, if we say that patients in rehabilitation, so we definitely don't have enough doctors or a therapist. And when we had pandemic, we saw what happened. So can we have any automatic system or automated strategies to help doctors and support patients to evaluate a subject or patient remotely from home? So you see that this is a normal person by doing some exercises, and then this is the stroke patient. So you can definitely see the movement, rhythmic and here totally, erroneous and not proper because the person can't do it properly. So when we can evaluate those kind of things and give some kind of level grading that, this is the best, for example, from here to here. So this is 0 and this is 100%, assume that in a normal 80%. And what happens that in between different gradings. And based on this, we can find. So remote automation for analysis of patients, remote monitoring from home are very important. So we have different activities on remote patient monitoring, like stroke rehabilitation, dementia or Parkinson's disease, autism, predicting heat stroke due to thermal stress, Parkinson's disease patients, wiring of phenomenon, antimicrobial resistance, sign language, AI and psychology related to mental health and well-being, like if when we work from home versus work from office, what are the mental health as well as the productivity and how these are connected. Digital social prescribing with social prescribing network, nurse care activity recognition, gate-based biometrics, and so on. So these are the different things we can see in healthcare in applications of AI. So we'll go for details, in the later part. But let's see that what is human versus animal versus AI, artificial intelligence. Okay, so we need to know what is the intelligence. We know more or less that the ability to acquire and apply knowledge and skills. So we call it, this is an intelligence. Or in another way, to solve complex problems or to make decisions in life that will help people or something. And definitely it evolves, okay? In the entire life, and we adapt to diverse environment for survival and reproduction. So we consider that combination of these are typically human intelligence. So intelligence is the ability to learn from experience and also at the same time to adapt to shape and to select environments. Um, adapt to shape and select environments. So intelligence as measured by raw scores on conventional standards, we know, and so on. But what are the different types of intelligence? Practical, creative, analytical. So the ability to get along with different contexts or being creative, like new ideas, or to have the ability to solve problems. And we know that different kinds of, strategies like, emotional, social, adversity, and the IQ. So these are the different kinds of intelligence. But another term of AI, basically the pronunciation is I in Japanese, also proper. I think I'm not sure about the Chinese pronunciation. It written koi, I'm not sure. But in Japanese, I means love. Aishiteru means I love you, and so on. So, but AI is not love. Some people don't like AI because we are worried. Some people are worried that it will have lots of consequences, and we'll think and see those issues in the future lectures on AI and the ethics and responsible AI, humble AI, and so on. And when we talk about AI to be humble and responsible, we must try as a human being to be like that. So you can submit to this conference if you are working on human activity and behavior. It will be held in Japan, in Beppu in Kitakyushu. So feel free to submit and attend online or, I mean, in person. How to develop an AI system? So what is an AI system? What do you need for this? And is an AI system hardware or software? So is programming the core of any AI system? So these are the few common questions or issues we come up and we learn throughout the system. But AI programming, long time ago, the prologue, you'll find that when we studied AI before, we studied prologue logic programming language as well. It was very well known and a long time ago and so on. But I mean, even though Python is old, probably 1991 or something, not because of the snake Python, but Monty Python in UK probably based on this. So Python is the most common language now by the AI researchers. There are other programming languages as well. So AI, let's see some areas. So AI is all around us. This is, he said, and he said that we shouldn't worry about AI. And in this video, Stephen Colbert took some interview, but at some point he felt that his materials, copyright issues are there. So with that, I just quickly finish here. So let's see. We'll move to the next one. Hello, everyone. So this is the other part. As you can see here, that AI and applications and different things. So in this slide, we'll see a little bit more. Healthcare, well-being, and security, and many other cases AI can be used. Now, remote patient monitoring, earlier we mentioned like stroke, rehabilitation, dementia, and so on. What to do? So here we go into details. Say I am a stroke patient and I have a stroke. I had a stroke and then I am having some kind of hemiplegia or some walking problem, gait problem. I go to the hospital, I mean, rehabilitation center or somewhere. They evaluate when I do some activities and based on this give some score. This score can vary from country to country or, I mean, a specific area to area. One is called SciS score or BBS or something like that. Now, can we evaluate remotely? The goal is that if I can do some kind of actions in front of a camera or using some sensors, and then you collect it and using AI method, you evaluate it and give me an estimate of SciS, just what doctor gave. So if we can do it, then this can be very important. Okay, so for example, SciS, if you just consider, see so many different I mean, categories, like not only 7, and in between, there are lots of other things. From video, if no video means red, from the video, it is extremely difficult to get this kind of pain information or language function or visual spatial cognition and others. And you give a score 0 to 5. If I am normal, you give 5. If I am, I mean, sick or super sick, or even I cannot move my hand or something like this, paralyzed part, you give me 0 or 1. So based on this, I mean, I am evaluated. Now, say motor function, it means that if I can, I mean, do like this way, knee mouth test 3 times, I get 5. If I cannot, give 1 or 2 or 3. But finger function, doctor can touch your finger and then say something to do, like moving or something. If you can do, but from the video, it's very difficult because you need a patient, I mean, doctor to see, but you cannot have a doctor because you are planning to do it remotely from home. So similarly, another application, another action, and so on. So this is just like 5. There are more. Now, this is the point that it's not easy because you cannot replace doctors, everything, and here human aspects, human touch, and others. And also, only video or skeleton data or IoT sensors or pain of face. What about sound? So one mode of data is not enough. And that's why, I mean, it is important that we can have more data, more modalities for better evaluation. I mean, mostly people used for, I mean, Kinect sensors. Kinect version 1 came in, then version 2, then the Azure, but they all stopped. Or before the Kinect, we used motion capture systems a lot. Again, we do, but I mean, expensive as well to make these kind of systems and annotations and others. Now, I mean, different kinds of AI methods there that if you have an image, we can get the body joint points by using like open pose. Okay, so open pose or alpha pose or even yellow version 8 or 7. So these kind of methods are there by which if you have an image, you can get the body joint points like where is your head and nose and wrist and another hand and body. So based on those body joint points and their relationships, we can understand whether the person is moving right or left or balanced or not, these kind of things. It's not easy because when we have skeleton data is not always accurate, especially at the ages. Okay, so when you try to track the skeleton and then understand different features and go for machine learning or deep learning based methods to understand, it's not easy. So there's an extra. I mean, if you want to, if you're interested to know that, I mean, so for example, different body joint points, their relationship. You can get that, I mean, distances or different angles or those angles and distances, their corresponding relationship. You can make some methods to understand different activities, especially to understand the progress of gait. Now you see that this person, I mean, if you consider that, I mean, imbalance this side and this side, the vertical line. So if you look at the body joint points, probably you can understand. Okay, but in some cases you cannot do it properly because normal action or gait versus problematic one and how much difficult, like, I mean, to understand the action quality, how to evaluate or score the progress of any development for months without visiting therapists frequently. It's not easy. RGB, like, I mean, image based, video based, we say that privacy is a concern, but image has good points that we have plenty of information from where you can understand many things, including pain, facial information, and others. If you consider body joint points, the skeleton, as we have shown above, that you have only few points, and some of the points are not accurate as well. So it's weak data, less amount of data. If you consider to put some kind of sensors on body here or here, then it is sometimes discomfort to the patient. So what to do? That's why in AI and healthcare, these kind of applications, we need to know a lot, we need to study a lot, need lots of data as well. And in healthcare, it's not easy to get many patients and so on. So it's extremely difficult because the progresses are very slow, minor differences, and you need to take longer period of time to collect data to see the progresses, and it's difficult, but huge scope to work. And another important point is that how to engrave emotion, because human being and the relationship between one to another, even patient to doctor, is not about just what we do. And still, a doctor as a human being can understand some of the emotional part of a person. But what about like video or without video, others? Can we understand? Can we engrave emotion? This is a big problem. And without video or image, can you understand the pain level? And pain level, it may happen that I have a huge pain on my body, but I'm not intolerant like this guy. Okay. So it hurts too much for him, but same pain, probably I'll try to control myself. So from the facial information, you may not understand that I have lots of pain. But physiological data, like if you have a watch, a smart watch, and inside some sensors, those sensors can give you heart rate variability, heart rate, and some other information from where you can probably get some kind of information that is related to stress or pain or abnormality via physiological data on body. Inside I have a storm, but outside I try to be normal. Many people will do like this. Okay, so that's why sometimes it's not enough to have only video. we need other information, physiological data and others. Okay. And also we have to understand that variations in psychology, because when we deal with robots or sensors or cameras versus human, because human interaction, we have warmth, energy, and vibe, and it varies from one culture to another culture. Sometimes some people, when they greet each other, very soft and cool. Some people, when they greet each other, it looks like a lots of noise because they make lots of sound, and they just I mean, very warm. So some people like warm things, some people like cold thing. That's the point. But human interactions are different and diverse, but wonderful. But what about human machine interaction? If the machine, like a robot arm or robot or any other kind of system, cannot understand properly a person, then it will be a problem, because there are issues related to culture, to understand human being, and so on. So in another application, you can say that similar to things like gait disorder, like if we have abnormal walking pattern, like early detection of gait disorder may provide a safer living for elderly people. Can we do it? Abnormal gait, can we understand? And that is one point. So we need to try. So have a look that, I mean, this data set, abnormality gait data set, where right arm is motionless. Some people may have, I mean, half motion of the left arm, or severe gait impairment, full body is affected. So the patterns will be different versus normal gait. And then we need to decipher and find ways how to do it. And as I mentioned in the beginning, that normal person is doing exercise, it's rhythmic, and you see that this is the one corner and this is the another corner, and more or less it is like, I mean, in the vertical position. But look at here, that, I mean, here, I mean, one, and here, and also it's even cannot go up. So the exercises are different. So and if we consider that, I mean, these kind of activities, and based on depth image or skeleton body joint points, if we consider different kinds of angles and distances, we can say this nature. And for a Parkinson's disease or another person, we can get something different. So if we can find the different patterns based on normal and something problematic one, and find a good solution, then it will help, I mean, millions and millions of people while they are at home. So that's it so far. So we can pause it. Control P, Control P. All right. Okay. P. All right. Welcome. So now I'll discuss about uh, mm, autism related things. Can we incorporate AI in autism study? Okay, so for example, for eye tracking, to understand based on some eye tracker, where we track. So for example, if you are a normal person, normal means new, we call it TD, typically developed. Uh, so on that case, here probably you will look at this robot on this face or this face or here. Probably you'll not look at here or here or the outside or outside. Most of the time you will look at around the points where normally we can see. But if you are not interested, so probably you will look out, even outside or somewhere else. So that's the point. So we need to check here that how AI can help to study autism. So autism spectrum disorder, or ASD, is defined as differences in social communication, which is not a disease, by the way. In some developing areas, it is considered, I mean, negatively, and it's no support for them, unfortunately. But if we can develop simple AI-based systems based on hand gestures or eye contact or facial expressions and so on, and help them to understand and support them, especially behavioral intervention programs or therapy, that would be wonderful. Not easy, but that's why we have to explore and try. So our team, we have been trying. So one option is that, say, now this is, when if I'm, say I'm an autistic child, this is me, and this is a person I'm interacting, communicating, and there is an expert to judge that what is my score. And then instead of this one, if I have a small robot like this one, the a small robot to interact with me, basically robot you teach what to do, and based on the child is interacting, and there are cameras underneath, like XYZ. You can see that there is a camera and sensors and other things if there are. So based on this, you see that how I react. Sometimes we are not interacting well in front of people, but when we are alone or with a robot or I mean play, we become joyful. We sing sometimes songs and so on. We know it very well. All right. But what about I mean, so this is the point that I mean, how to predict any kind of score. We say, for example, autism diagnostic observation schedule score or ADOS score to classify and so on. Okay, so instead of human interactions, if we have a robot, instead of robot, it can be like a computer screen. In the computer screen, there will be a small robot or cartoon, and then you communicate. So interactive way, and based on during that time, based on the upper body movement, because the child is basically sitting, so you cannot see the lower part, but upper part from the cameras, or I mean, if you can get the upper body joint points and head gaze vector, eye gaze movements, and eye gaze vector, these kind of things, can we understand, and so on. So this is one. So autism study using eye tracker to understand that whether someone is a neurotypical children or someone is having ASD. So if there is a eye tracker, and the eye tracker will track that where the eye is looking at in the screen. So that's the point. So if it is, I mean, say a ball is moving from here to here, so you will look at like this way, saccadic movement. But if this is movement is, I mean, random for an autistic child, then we can understand this is a problem. Now, autism detection and assistance, facial expression for kids, eye contact. Can we have some kind of a real time or semi-real time online support and follow-up system? So I'll go into details about the therapy session. So normally therapists do different things, activities like raise your hand, have some I mean, one-to-one communications, and then sometimes they give some kind of games to do. How long does it take? How quickly you can do, and normally you can do. Based on this, the therapist, for example, gives some score. So this is just one example. Now, if we have children and their information we can collect, and there are cameras during that part, that would be nice. So therapist can monitor and so on. So as I explained earlier, this is the therapist, there is a robot, and the child will interact with the robot, and based on the cameras and sensors, some other informations are collected, and you can see what is going on. So the goal is to I mean, help through robot assistance and some kind of therapy alongside human therapy. Definitely, we cannot replace the human therapy, but when the child is at home, probably the child is doing something good, which is, I mean, not doing in front of a human being. So the main motive is to record the data of the children with ASD and to reduce the load of human therapy and support at the same time. Sometimes playful things can make people happy. We, even if we are angry, if we try to be happy and smiling, that will help us, we know. So similarly for any children, it is important. So there are lots of works in this data set. We have 300 hours of therapy. These are extra, so if you want to look into details, then you can look. But the main goal is that, say for example, there is a camera, there can be another camera, there can be some other things. Okay, and in this case, you have eye gaze vectors, head movement, and upper body skeleton, body joint points based on 3 different activities, and to see how they do. Okay, so we can have different kinds of pre-processing and feature extraction to extract gaze, head movement, and others. But and then go for machine learning applications to understand. However, this is not enough because we had only 61 kids, 61 children, and collecting data only once is not enough. We need to check different time, because maybe this morning it's cloudy outside, or I didn't have a good sleep last night. So probably I'm not good in mood. But when I am super happy, probably my performances and interactions with others will be different. So that's the point. We can also work on facial images. So my groups, they are also working to understand that from the facial image, can we understand whether someone is autistic or not? Okay, so how can you do it? So there are different ways. These are extra if you want to see. So I mentioned normally we do manually by using observation or interview based. There are different ways, or autistic I mean experts therapies they do, but automatic means like using machine learning or deep learning. How can we do it? Okay, so we showed that robot enhanced therapy is so skeleton, or we can collect the EEG data or MRI of the brain, which is much better, and face image or eye gaze, head movement, and then after the data collection, we go for deep learning based methods, try to understand so that we can find ways to improve the quality. So this is the extra. I mean, if you're interested, you can read it. Otherwise, it just, I mean, quickly pass through. So different modalities for analysis of autism. So I mentioned like skeleton can be done, eye can be used. Here, some of our works are mentioned. Facial images can be used. So forget about this kind of difficult methods. But the main point is that when we have facial images, okay, of autistic children versus non-autistic children, then can we understand just looking at the face? Somebody can say, oh, impossible, because I say, oh, yes, because only from one face or few images, how can you judge that a child is autistic or not? It is just like a very early stage screening. Consider that during COVID-19, when we went to the airport, they first checked the body temperature. If or in a shopping center or in a hospital, so if the temperature is higher, then we are not allowed. We need to check whether we have, I mean, some kind of COVID or not. Okay, so probably, I mean, when a child is at very early stage and where people cannot understand, then if we have a smart method. Based on this, if we can understand a child's behavior, I mean, not behavior, like whether the ASD or not, based on this, probably you can find ways and then go to an expert. Because normally, if my child is just a little bit different and early stage, we don't know, we don't take the child to any, I mean, expert to check whether the ASD is there or not. And in most of the parts of the world, okay, there is no option now for checking like this way. Forget about the rural areas, even the cities, you cannot get schools and doctors and opportunities to evaluate them. So that's why I'm saying that we need some basic screening type, but the problem is that we don't have enough data set. So we need bigger data set. We developed a data set, but not good enough. But only 8,000 images, which is nothing, because computers, I mean, vision or imaging field using deep learning, we know that data is the key, and more data. Everywhere data is the key, but this big, huge success is that because of data set. So we need a data set. So that's the point. And we can move to the next one. Hi. So in AI, we can discuss about heat stroke. I mean, in England, for example, last year and this year, for example, many parts of Europe, I mean, temperature in Japan, several years, the temperature during the summer is very high. So, and what happens that many people die because of heat stroke or related problem. So I visited a few months ago in Japan, and we are in the rural areas, mountain and wonderful, I mean, mountain rivers, and driving suddenly found that few, I mean, ambulances and police cars, because someone had probably heat stroke, and then they came to support and so on. So it's getting more and more. Now, can we protect someone that, oh, you will be I mean, a candidate for heat stroke very soon, so be careful or don't work too much. So stress, thermal stress, heat stress, and work stress, life we have stress, and during this time I'm working hard, at the same time I have thermal stress. So work stress, thermal stress, mental stress together, it can be complicated, and it's not easy because from outside, maybe you are smiling. I try to smile even though there are lots of stress inside. So we have to do that so that we can survive. But inside, maybe you are just getting trouble. So before having any stroke, what are the solution? Okay, so let's see that heat stroke in last summer 2022, summer heat waves had a devastating impact on public health with 56,303 deaths in England and Wales. It's surprising, isn't it? So this is the reference I found. So from ons.gov.uk. So it's really dangerous that for only few weeks hot summer and 56,000 plus people died, and many people had a stroke as well. So how can we exploit AI and IoT sensors to save life, give thermal comfort? It has more impact as well, I will see, because if we have, thermal comfort related issues, then we can even redesign houses or future plans so that, we can save energy. And and this is the point. Another point is that Parkinson's disease is another one, so we'll discuss later. So for that purpose, I mean, mm, mm, so Parkinson's disease issue is another one. Like, when we have wearing off problem means that I have a Parkinson's disease. I take a medicine, but this medicine, they give us like anti-Parkinson's disease medicines, for example, levodopa, and it should stop my vibration of hand or rigidness of the body or maybe weakness of the body or something like this. But what happens that it becomes off. Wearing off means like off time means the medicine is not working. So it should work say for a few hours, but it is coming back quickly. So I am vibrating or tremor, or I have some problem. And if I don't know, then who will help me? Normally, we support our family members who have Parkinson's disease, and we gave this medicine. Doctor gave the medicine. We thought that okay, next 4 hours, he or she is fine. But what will happen if the wearing off comes quickly? The medicine is not active and so on. So that's the point. So one option is that we can collect heart rate, number of steps, stress level, sleep pattern of the person, and we can have like a wearing off periods data set based on some wearing off questionnaire, like a patient is giving that when the symptom came, when the symptom were absent and something like this, and the taking of the medicine, this kind of report. Based on those reports, if we can develop any AI method, we can probably predict or forecast when will be the next one. It will take time. Dataset is extremely important. So we participated in a global competition in Germany this year, and then based on Japanese universities data set, they arranged this competition. We become second. Basically, if you win the winner, you could get 0.1 million Japanese yen. We didn't get this one, but we got in the heat stroke challenge. So heat stroke, as I mentioned, that it's getting higher and higher, and global warming, life-threatening situation, and it's not good for the future. So what we need? We need to find solution. For that solution, we need a data set. Again, to collect the data set in Japan, one university with a company, they collected data set, they created artificially situation so that people can have different kinds of activities and having the stress, and based on the stress to collect the physiological data like these kind of things, and then we can understand based on AI. So AI has lots of scopes to explore. I just showed few examples what we have been doing or others are doing, but we need to do a lot. So with that, I'd like to thank you very, very much. We'll come back to others.